Hi, everyone. Welcome. My name is Nicole Fisher. I'm one of the clinical educators here at HealthInfoNet. We're going to go ahead and get started. We appreciate you taking the time today to join us for this webinar that's going to have our behavioral health use case and intervention focus today. And I will be joined by Kaylee Boucher, who is the program coordinator for BHH and OHH, Department of Health and Human Services. So let's go ahead and get started. So this is just some information on myself and Kaylee. So I'm going to go ahead and pass it on over to her to do her presentation, as we will show some information in just a moment.
Thank you, everybody, for joining us today. I'm going to do a brief overview of the Behavioral Health Home and Opioid Health Home program. Some people on the call today probably are very familiar with the programs, so I won't get into too much details, but after the call, if someone on the call would like more information, please feel free to reach out to us, and we would be happy to review that with you. If I get spotty for some reason, I do have a coworker that will take over for me because I've been having some Zoom issues this morning, but hopefully it will be good and ready to go. So I will start with the Opioid Health Home program first. This is one of our newest programs under the value-based purchasing model. So the Opioid Health Home program was developed in 2017. It started kind of slow at first, but we have over 2,000 members that are enrolled in the Opioid Health Home program and over 400 providers. I'm sorry, not 400, 40 providers. Sorry about that. The OHH services are medication, OUD counseling, office visits with a MAT prescriber, urine drug screening and care coordination, and peer recovery support. Some of our staffing requirements, because we are like a team-based approach, some of the staffing requirements on the team would be a clinical team lead, the MAT prescriber, a nurse care manager, clinical licensed OUD counselor, peer recovery coach, and patient navigator. To be eligible to participate in OHH, you do have to have an OUD diagnosis. This will focus, so with OHH and BHH, you'll hear me kind of talk about it in both services, but some of the structure is very similar in nature. We do provide comprehensive case management, care coordination, health promotion, comprehensive transition of care, individual and family supports, and referral to community and support services. They also, as indicated earlier, they will get their medication, they'll get counseling, and they'll get to see a MAT prescriber and the peer recovery coach. We really focus on building that coordination between primary care as well in the OHH program. Right now, our OHH providers do not have any quality measures under the Maine care services. For the uninsured, they do focus on housing and employment. But moving forward, when our new policy comes out, we will have some pay for performance measures. And our providers will be using HealthInfoNet a lot, I foresee. Any of our providers in the Opioid Health Home program that provide the uninsured stuff to the members, they do have to have HealthInfoNet as one of the requirements in their contract. So today, Nicole will go into some features that are available to the OHH providers and other providers on the call as well. And if you have, like I said, if you guys have further questions, please let us know. We offer lots of technical supports around our measures for Opioid Health Home program. We also offer lots of technical support that is in person, virtual, to kind of review claim stuff, to talk about struggles that providers may be having, or areas of difficulty that they're having serving their members as well. So again, it's very hands-on with our providers. The next program that I'll be discussing is the Behavioral Health Home program. The Behavioral Health Home Program has been around since 2014. It serves adults with serious and persistent mental illness and children with serious and emotional disturbance. On this sheet, it says as of August 2019, we have 37 organizations. Right now, we actually have like 39 and over 150 locations around the state, and we cover over 1,300 members between adults and children. Again, this program is to help build that care coordination between physical and behavioral health. They are required to have a memorandum of understanding with a health home provider, which is in the primary care setting. And it really helps to try to build that care coordination between the behavioral health and the physical health. We work on improving patient experience, reducing costs, and improving population health. In the behavioral health home program, we also have some quality measures. Right now, we're working on, for our data-focused learning collaborative, we are working on adolescent well-care visits. And we are also have a pay-for-performance measure that all providers work on, and that's for members that are receiving 2 or more fills of antipsychotic medications. They have to work with the member on getting a HbA1c testing or fasting glucose testing to be able to really monitor to make sure that they don't get diabetes or not at risk of getting diabetes. So HealthInfoNet is not a requirement for our BHH providers, but we strongly encourage it. They are able to use it, again, to help with making sure, checking on like care coordination, check with ED visits. If they're going to the ED, they get real-time information. And again, Nicole will go a little bit further into what's available for the providers. We also offer lots of technical assistance in this program as well with our providers to make sure that they are really building that strong coordination between primary care and behavioral health. We have working groups with our health home and behavioral health home providers, as well as our opioid health home and community care teams to help build that collaboration and coordination. That was a very high level overview. And again, if anybody on this call would like some further information, please feel free to reach out to me. I would be happy to set up some time. We can talk about our programs in a little bit more detail.
Great, thank you so much. We really appreciate this coordinated effort with the BHH and OHH programs. And so obviously today, having that high level overview, but also we wanted to touch upon some of our top 10 behavioral health use case and interventions, which also can sort of dovetail into a lot of what the OHH providers are doing as well. So I wanted to touch upon those. We will, after we're done with the PowerPoint, I'm gonna get into a demo of our clinical portal in our test environment. I'm not gonna get too into like a full training of the clinical portal, but I'm just going to really highlight the areas to which you can find a lot of this information in a patient record. And certainly, just as Kaylee said, if you want more information or want a full training for you or any of your staff, you can always reach out to us as well to coordinate that. But let's go ahead and get into some of these use cases. So obviously, some of the great areas to be able to do targeted case management can be utilized through our clinical portal. So working with your patients to avoid any of those unnecessary ED admissions, hospitalizations, readmissions. Once we go through a demo of a patient record in the clinical portal, I also, to close things out today, wanted to just go over our notification tool, which will help with a lot of these targeted care management services, being able to get those real-time or daily summary event notifications for patients that you want to track who may be high ED utilizers or who are going to the hospital a lot. I always train folks that really a patient record, in my mind, especially when working with those folks in the behavioral health setting, it's going to tell you a story. The information in that record is going to tell you a story. The information that's not in the record is also going to tell you a story. So being able to proactively look and identify some of those warning signs and assess any risk for returning to the ED or readmission. If you're able to track those trends over time, that a patient's going to the ED the same time every Saturday and has for several weeks, then maybe there's a transportation concern to getting to a particular provider. Maybe there's some food insecurity issues that haven't been discussed. So it really is going to tell you a lot. But also being able to, as well, to proactively schedule those PCP appointments, to avoid ED admissions, and like I said, to avoid any of those, or being able to identify any of those warning signs. Hospital support, so being able to assist hospital PCP, nurse care managers through reviewing ED and hospital discharge plans, making any further treatment recommendations as needed. So really helping to make sure patients who are leaving the hospital setting, whether it's an ED visit, whether it's a hospital admission, that those folks are getting the support that they need. Another really key piece of the clinical portal that I always highlight is being able to help locate any of your missing clients. So those folks that you haven't either heard from in a long time, those folks who their address or their phone number is changing frequently. Because we have several connections throughout the state to several different types of providers throughout the state, we get real-time data from those providers. So if somebody has been seen for care, their address is updated in real time, their phone number is updated. So being able to log into the portal and see what we have as the most recent contact information for patients can really be helpful. I've done trainings too where a user has pulled up one of their patients and come to find out they were in the hospital and they had no idea they were even in the hospital and they hadn't heard from them in several weeks. So it's another really key area to the portal. Comprehensive transitional care, so obviously making sure that there's post-acute care plans within 24 hours of those ED or hospital events. Being able to provide same-day services on date of discharge if possible. Being able to look at medications, follow-up plans. Is there a need for equipment? Does the patient have all of those things in place that's going to make them successful when they are home, and really avoid any repeat visits or repeat admissions? Reviewing the med list and discharge instructions so that clients know that they are supposed to either pick up a particular medication or they, the nurse care manager can walk them through any medication education if necessary, if that wasn't clear at the time that they left the hospital. Being able to work together with medical homes, and obviously being able to advocate for resources and follow-up care for those marginalized clients or those folks that sometimes can fall through the cracks. So really making sure that this process is very smooth and seamless.
You can hear me? Good, good, good.
Being able to identify and coordinate with care team members. So being able to log into the portal and see where has a patient been, who are their other treating providers. Oftentimes, folks are seeing a lot of different people, and if they have anxiety or depression or other mental health conditions, they may not be able to retain all of that information and know who they saw and when they saw them. So being able to look in the portal and identify those providers, being able to either reach out and coordinate that care or see if there's any duplication that needs to be addressed as well. Also looking at med reconciliation, so reviewing the pharmacy information that we have in the clinical portal, avoiding any duplicate prescriptions, making sure a patient has been able to pick up a prescription, those type of things, and I'll show you what that looks like in our demo as well. To be able to intervene with a client post medical event, so being able to debrief with them, talk about what brought them there, make sure there's a plan in place after, as I mentioned before, being able to look at lab tests, making sure there's a plan in place for compliance with treatment is going to be really important for your clients and patients. being able to help educate, so being able to work with those high utilizing clients. So as I said, having that information in the portal tell you a story where you can possibly help them. I always say our users are oftentimes detectives in that way, where they're sifting through all of this data and all of this information to help come up with a good plan for their clients that will help them seek other resources that may not always include the emergency department when they're in crisis or when they need help. Being able to really identify that good safety plan for that patient, using the data to do that. Having them take ownership of their care, really involving clients in the process. The whole idea of having the health information exchange is to be transparent with your patients and clients. So not having HealthInfoNet be this secret portal that folks log into. It's meant to be a collaborative part of patient care, to talk with them and identify those areas that need to be worked on, as well as helping educate and motivate those folks that might need that as well. And next slide. There we go. Also being able to look in and see what we have for active problems and diagnoses, make sure that patients are receiving the right treatment. If somebody may have had missed something previous, but a behavioral health provider is able to notice that and maybe collaborate with that client's primary care provider to bring to their attention that there might be some issues with the diagnosis. And also, too, really identifying those gaps in care as well as the overuse. So making sure that duplicate labs are not ordered, so that patients aren't having to make separate appointments or get poked again for a lab result when one was just ordered, you know, a week ago. Being able to advocate for more care if necessary, or to see a specialist if that's appropriate. Making sure that those repeat testing that doesn't need to occur, if somebody's going very frequently to get an abdominal CT, being able to collaborate with those providers to make sure that that testing doesn't need to reoccur on a regular basis. So those are some of just the highlights and sort of those top 10 interventions that we have found here at HealthInfoNet, especially working with our behavioral health providers in the community. These were some of the areas and things that they really brought to us that are helpful and that we want to share with others. So I'm going to move on. We're going to go ahead and I'm going to show you a demo of our clinical portal here and where to find a lot of that key pieces of information. I know a lot of folks are fairly familiar with the clinical portal and looking at a patient record, but we certainly do want to highlight some of those areas for folks. So bear with me as I change my screen here. Okay, so this is the test environment. So there's no PHI here. Like I said, I'm not going to go through a lot of nitty-gritty details here, but you are always welcome to reach out to us. We have a lot of different resources. I know we have it in the PowerPoint at the end, but I always get eager to share it too as well. But we obviously have webinar trainings that we can do individually. Obviously, some of our in-person trainings we are available, but with COVID, everybody I think has had to get a little bit more creative with clinical education. So we are always willing to jump on a webinar with folks through Zoom, but we also do have a great resource with our HealthInfoNet Academy, which will share that information, like I said, at the end, but it's our online tutorial-based training program. So I'm just gonna go through and pull up one of my good test patients here. So bear with me as I pull him up here. So I'm breaking the privacy seal to open up my test patient. So this is what a user will see as soon as you go and pull up a record. Couple things that I just want to highlight and make note of. Because I didn't do a full demographic search for my patient, you would see one, whether or not we've had a patient opt out of the clinical portal. So that is a patient's right to do so. So they can certainly opt out their information in the portal and you wouldn't be able to access their information. We also do have some mental health data that is in the portal. There are 3 ways to access that. A patient can opt in that data. They can get verbal permission, a one-time verbal permission to a provider who can access it, and then the data can be accessed in case of an emergency. So that is available. If a patient has not chosen to opt in their mental health information, you would see this disclaimer here over on the left-hand side that indicates that there is sensitive data that's not displayed due to legal restriction. If a patient does give verbal permission for you to view that data, you would click Break Privacy Seal here. And it's here that you would indicate that, one, like I said, you've either received that verbal permission or it's in case of an emergency. And you acknowledge it by clicking this check here. And then you either determine, is this an emergency situation, or did a client give you verbal permission, and then you would choose your reason. It's here. I always recommend that folks type something in just as a refresher. So we do take this information very seriously, and we have audit capabilities at HealthInfoNet, and then each organization that participates with us also has an auditor at their organization. So if somebody were to audit records and come back to you, just typing in this information is just a helpful way to refresh your memory, because folks are busy and they see a lot of patients and clients, so they may not remember all of those details. So in this example, I've gotten verbal permission. I would go ahead and type something in. I would break the privacy seal here, and then a sensitive data displayed folder would populate. My test patient here doesn't have any sensitive data to display. I will tell folks, we do have, and at the end here, before we close, I will show everyone where our data coverage sheet is, but it is a hyperlink in our login screen. And I always bring folks to that to show them what behavioral health providers we are receiving data from, because we take in the behavioral health data, but we do not have any substance use data currently in the clinical portal. That is still shielded and protected due to 42 CFR Part 2. Lots to come on that. Things are changing, and we are working and have started some work around possibly in the future being able to incorporate that data in the portal. But right now it is a handful of community-based mental health providers that are sharing data. So none of the state psychiatric hospitals, Acadia, Spring Harbor, Riverview, or Dorothea Dix are sharing data with us. So just in case folks get that verbal permission from a client, or even if a patient has opted in their behavioral health data, it is important to note that there would only be data for that client if they saw a particular provider that's listed on our coverage sheet. So I'll show you that at the end of the demo, but I just wanted to highlight that as we first open the record. So it's here, like I said, this is the view that you see when you open a record here. The first thing, part of one of our top 10 interventions here, was the demographic information. So really important, come here, see what we have for address, see what we have for a phone number, because it could be very different. A patient could have gone to have some lab work, or saw their primary care provider who they may have updated their address or phone with, and you'd be able to reach them. Here we have our allergies are listed over on the right-hand side, as well as active problems. And in both of these screens, I always point out to folks that if you hover over the location, it will give you a full printout of who we got that information from. For space purposes, we had to abbreviate that. But this is really a great place to see where a patient has been, who has been their provider. So obviously being able to help either with any care coordination efforts, being able to get some more information from a particular provider. everybody who sends us data, everybody doesn't all send us the same amount of data, so it does vary and depends largely on a lot of technical components to be able to incorporate that data here into the clinical portal. So for some smaller organizations, we may only be getting that demographic, active problem, and encounter information. So you may still have some follow-up, but at least you now have a direction to go in, and you know who you need to reach out to, and maybe have a discussion with your client and being able to gather the information that you need. So that's really important to know. Below these two areas here is our prescription information. So that medication information is right below there. A couple things to make note of this is the information that we get currently is from a pharmacy claims database called SureScripts. So ultimately, a patient would need to have their provider send their prescription to a pharmacy. That pharmacy ultimately would process that prescription. It would hit the SureScripts pharmacy database, and then it would come into us here in the clinical portal. So with that being said, it isn't a complete and full picture of medications for your patients. It isn't 100% med reconciliation, but at least it is giving you some information. Along with that, we do get Maine Care pharmacy claims information. We do get that once a month. So that is important to note that once we get that file from Maine Care, it is populated here for our patients in the medication section. So this is always a great place to look, but also be having a conversation with clients because it's here that you could see that a patient hasn't picked up their lisinopril or another type of medication in a few months, and maybe their prescription ran out and they haven't been able to pick it up, or they didn't call their PCP to get that refill. So it's really important to, like I said, be able to see what we have here, but also make note of maybe what's not here and what should be there. I also, in regards to med reconciliation, I highly encourage our users to go into our document tree that's over here on the left-hand side, which we'll go over in just a minute. But we do have some documents here that may be helpful if a patient has been to the ED recently, been discharged from the hospital, seen a provider that's sending us office visit notes. So being able to look through all of those documents in the document tree to see what they have listed for medications is really helpful as well. Below medications is our encounter and visit history information. So it's here that we get several different visit types or encounter types. Obviously, emergency department, inpatient hospitalization, outpatient visits, reoccurring type encounters, physical therapy, infusions, chemotherapy, those types of things, as well as swing beds and pre-admits. So there is a lot of information here. I always tell folks this is really a great place to start. If they're really short on time and they just want to get a good picture as to what's been going on with their patient lately, they can come here, and especially the encounter table. We obviously have date range information, the type of visit that happened, the service provided, chief complaint if we have it, who they saw as a clinician or a provider. And then similar to above, when I asked you to hover over the location for more information, the same thing happens down here for diagnosis. So for space purposes, we've had to abbreviate things, but if you hover over that coding or category, you're going to get more information around the diagnosis, as well as if there are multiple diagnoses that we couldn't list here. You can always hover over and get full detail about that. And then insurance information, and then where did that event of care occur? So which organization or provider setting did that occur at? So this is really, like I said, a great snapshot into a high-level overview of your patient and what's been going on recently. Next, I'm going to point you over to the document tree. So I'm going to open this up just a little bit. Here you can see these are all the different types of documents that we receive in the clinical portal. This works very similar to your email, and it is specific to the user. So this is a test patient I use a lot, so I'm in and out of the different documents all the time. But obviously anything that's bold is something new to me and something I haven't opened. Anything unbold I have already looked at. The tool does automatically default to category, but you can come up here to this eyeball here and view this information in several different ways. You can look at a date range, you can look at a service or at a provider. You can also sort date ranges. So as you get more familiar with opening up a patient record and you're just curious as to what's been going on recently or any recent documentation that you may not have viewed yet, you can certainly show the different date ranges here. So whether it's the last 72 hours, if you know event of care occurred over that time period, 14 days, 3 months, or any specific date range that you so choose. My test patient here is very old data, so I won't show you how neat the date range looks like. But here is the service, so where is a patient going for different services, as well as provider you can sort by. So just an easy way, depending upon what you're looking for and how you want to make it work for you, you can certainly sort those in whichever way possible that you want to look at it. So here, let's just go through some of these documents really quickly here. Obviously, care plans, consultations, we do have discharge summaries as well as history and physicals. So I'm just going to open up this discharge summary really quickly and really show folks that the discharge summary that you see here in the clinical portal is going to look exactly the same as if you were to get this information straight from the provider and have to go through the medical records department and do all of those normal paperwork flows that so many of us have been used to over time. But it's the same information that you would be looking for and interested in viewing. Same thing with emergency record, ED reports, those types of things, all of the same amount of information. We do have immunization information. I'm going to skip laboratory right now just for 1 second and go over it at the end. Microbiology, we do have operative diagnostic procedure information. OV outpatient is our office visit notes that would live here in this section. We do have radiology reports. As you can see, I have that sensitive data displayed folder that we talked about originally, and vital signs is listed here as well. So if we go back to laboratory, so as Callie had mentioned, there is the requirement for those folks in the BHH and OHH in regards to HbA1cs. So this is a great place to look up those laboratory results that you may need to find for your patients. Obviously, it's going to default here to the most recent one, or excuse me, most recent and down. The really neat thing about these laboratory results is we do color code them for you. So black is normal, yellow is abnormal, and red is critical. If I go ahead and open up the laboratory result here, you're going to see you're going to get all the same information that you need to know about your patient, who ordered it, when did it occur, and what the actual result is. We do also have great functionality within this section where you can actually graph cumulative results. So if you click this View Cumulative Results hyperlink here, you can go through and pick different data sets through laboratory results here. Click on the ones that you want to graph or trend over time. Hit Graph. This isn't going to look as pretty as I want it to, but this is where you could do so and be able to see how a patient has been doing over a particular period of time with a particular lab result. I always let folks know this is not only a great tool for a provider and a user, but I also think this could be a great conversation point with clients, and especially those folks who've been really working on particular lab results to improve them. It could be a nice kudo and a pat on the back if they've been able to improve that. You can print this graph here that's up in the right-hand corner here. So that's just some great functionality that we have within the portal. One thing that's also really great too is that you can at any point come up to the magnifying glass here in the document tree, and you can actually search for a particular lab result. So if you know that you're searching for something in particular, and say you have a patient who has a lot of lab results here, rather than having to scroll through and find the particular one that you want, for a lab or for any document here that you're looking for, you can always come in here and start to type in, say, CBC that you're looking for, and the tool will automatically start to pull in that result for you. So it saves you a little bit of time there. So that's really overall sort of the patient record in a nutshell here. Just to give folks an idea.
So Nicole, this is Chad. While you transition to the next portion, I figured I could just get a couple of the questions in the chat results. So
sure.
The first was a request for another training around home healthcare. I think that's a great request, and we can certainly take that back internally to assess if it's a new webinar event that we could offer. If your teams also have a need for an individual one-on-one training, we can certainly offer that as well. So feel free to reach out to us and we can schedule that with you. The other question was, what's the best way to deal with duplicate or sometimes triplicate patient accounts? And I think the best way is for our organizations and users to reach out to our customer care team and to supply the specific medical record numbers that you're seeing associated with those duplicate or triplicate patient accounts. And we can work with you in real time to merge those accounts where appropriate so that it consolidates the patient accounts into just a single source of truth. All right, Nicole, back to you.
Hey, okay, nope, those are great questions. And that is really good to know because it does happen. So yeah, please reach out to our customer care team who can work on those duplicates for you. And if we have enough information that we need to, with certainty, know that that's the same patient, we will certainly work to put that together in one single record. One thing actually before I get to notifications that I just want to highlight, here up at the top, we do have a VA connection. It has been down as the VA has migrated to a new system. It's a really cool connection that we have with the VA, so we are certainly working with them and working hard to get that connection back up. But if you click on this VA tab, it will walk you through the instructions to be able to access some VA records for veterans that you may be working with. I'm going to skip over my patients for a sec because we're going to get into that in the notifications here. But I did just want to highlight the community services tab. So this is a fairly new, don't worry about that, a fairly new area here for us. In the clinical portal, where we hope to really expand upon this in the future and get more social determinants of health information. Currently, it is non-emergent transportation data that we are getting from Maine Care. It is primarily from those community action programs who are providing transportation services to patients. And hopefully here my test patient will load. But this is a great place to just know just a little bit more about your patients in regards to maybe some appointments that they're going to and getting the necessary transportation to those appointments. And certainly, like I said, we hope to get more of that data, and we will always keep you updated once we do and provide more webinar opportunities and different ways that we'll communicate out that information. So more to come on that. I'm here in my test environment, so our technical folks are often doing lots of different things in this environment, so don't worry about that PDMP section there. It's not that way in our production environment. But let me go ahead and I'm gonna log into our production environment here quickly. So before I get into notifications, I'm just gonna show you the hyperlink where it says click here to see data captured in HealthInfoNet. Hopefully you're all seeing that okay, chat. If not, just let me know. So these are all the different types of connections that we have. So all of the different categories here are over on the left-hand side. Hopefully I won't make everyone nauseous here by scrolling down, but I just wanted to highlight the behavioral health providers. So these are a handful of behavioral health providers that we have. And then these check marks will tell you, sorry about that, will tell you the different data points that they are sending us. So it's really important to get familiar with this document, have a good understanding of who those folks are, who's sending us data in case you're looking for something in particular. This is a great reference. You are, of course, always welcome at any point to reach out to us at HealthInfoNet and get more information, or if you have any questions.
Nicole, while you're talking about data coverage report, there was a question in the chat that was related to it, so I thought we would address it now. So there's a question about whether providers are at some point going to have to use HealthInfoNet, because if not, then there may be data gaps. And I guess my comment there is that if there are data gaps that users are seeing within our clinical portal, please report them to us. Any healthcare systems or providers that you think should be sending us data that may not be, based on that data coverage report, and we can certainly reach out to them to try to make that connection in place. Our team always has ongoing communication with our clients and customers to try to close those data gaps where possible, but please always report them, and we can certainly try to do our best to do so as well.
Great question. So I'm going to go into our notification section here. I always educate folks, when you click on notifications, you're going to see this My Subscriptions and My Patients. I always have folks start with the My Subscriptions first. So it's here really determining the type of notification that you want to get and how you want to get them. So it's here that you see your email address listed. This is the email address that's associated with your user account. So that will just automatically default there. When coming down to the notification types, these are all the different options that we have for folks. Obviously, the top four here are probably the most popular, those inpatient admission and discharges, the ED admission and discharge, as well as laboratory results. And I'll also highlight and put in a plug for our new COVID laboratory result, as well as patient deceased. So that does have to occur within a hospital setting, but you can get a notification if a patient has passed away in the hospital. So let me just highlight, I'll do my little COVID announcement here. So we do have this final laboratory result notification available. It is really important as you think about notifications and what you want to receive and how you want to receive it, to really be a little bit strategic on how you might be intervening with a client based upon the information that you're getting. So for some users, they want all the laboratory results. They're following up. They'll be following up with those. If they click on that final laboratory result available, you will also be getting any COVID laboratory results for your patient. So for those who may have a use case or may not be interested in getting all laboratory results, but they may only want to be getting the COVID laboratory result, they would want to make sure that they're clicking on this. We wouldn't want to have you get duplicate emails or duplicate notifications for your patient. So it's really important to determine the difference between those two. But if you do get all laboratory results, it will include the COVID laboratory result. So as I mentioned, let's just walk through a couple of examples here. So depending upon the workflow, say I was a community case manager, I'm working with clients in the community, and I want to get a notification when a patient is admitted to the ED. because I may want to intervene in real time with that patient. They may have, they may be a high utilizer. They may have a safety plan in place, which doesn't involve going to the ED as their first step in that plan. And so if they're there sitting in the waiting room, that's exactly how quickly you can get that real-time notification, you may be able to and want to support them through that visit and sit with them in the waiting room, or you may want to try to help maybe talk to them and discuss some other options rather than being in the ED or other things that they can utilize in the moment. So since I've clicked on that patient admitted to ER, I'm going to come over to my delivery option here, click this change button. I've obviously trained on this several times before, so my real-time email was already checked off here. Real-time option, delivery option was clicked. So I'm going to click OK, and it's going to save that notification delivery option for me. If I am a nurse care manager and I want to follow up with patients who have been discharged from the hospital, I want to do that post event follow-up. I want to make sure that they're getting their discharge medications. I want to make sure they have their follow-up appointments in place. You can click the inpatient discharge option here. And then it's here too. You could get that in real time. And as I mentioned, this is happening very fast. We've had examples of folks tell us that they've called a patient to follow up with them and that patient hasn't even left the parking lot of the hospital. So that may be how you want to have that intervention as you're following up with folks. It could be that if you have a lot of patients that you're following in your patient panel, which we'll get to in just a second, that it may make sense that you don't need to be constantly getting those real-time notifications. You want to get a daily summary email at 6 a.m. the next morning. So what happens is around that 6 a.m. time period, you would get an email notification that from the previous day's events of care for whichever notification you've subscribed to. So that may make more sense to you, that you can work off that list of folks and being able to follow up, say, throughout the day, because that's just what works for you. So it's really important to think about these things. I always let folks know you can at any point change these notifications. It's always really important to, let me just highlight, I'm gonna click the save with my delivery options here. But oftentimes people get really excited if they weren't aware of these notifications and now they are. They may get really gung-ho and they want all the information, but after time they realized it's very overwhelming and it may not make sense to them given how they're having that intervention. And so certainly you're more than welcome to come in at any point, change your options. And it will take effect just as soon as you click this save button. So always keep that in the back of your mind that you can change them. So once we've determined these types of notification subscriptions that we want, it's really important here to come to your My Patients. So as you can see, I can do this from the notification section, but if you also happen to catch me in that patient record in my test patient, there was also a tab that said My Patients. You can always utilize that too as well to add a patient to your patient panel from the record. But it's here where you can add and remove your patients however you want to do so. We do say if you have more than 100 patients to add to your patient panel, please reach out to our customer care team and they can help you with what we call a bulk load notification panel, where we can put all of those patients in your patient panel for you. So I always highlight and give a shout out to our customer care team whose email and phone number here is right at the bottom. So I'm just gonna show you just very quickly how easy it is to add a patient to your patient panel from the screen. So I'm gonna go ahead and add a Donald Duck here. I've typed in first name, last name, I click search. All of the Donald Ducks will populate here. As you can see, this Donald Duck actually opted out, so I'm not able to add them to my patient panel because they have opted out of the portal. But this Donald Duck here from Bangor, that is my patient. I click the green check and I add them to my patient panel. So this is a great functionality and feature. You can always search for a patient. So if you had some of those larger patient panels and you needed to find a patient that you wanted to remove, he's no longer your patient, you go ahead and you start to type the patient's name. It pulls in that information. This Mickey Mouse here is no longer my patient. I no longer want to get notifications on them. I click the red X. It's going to ask me if I'm sure, and there you go. All set, taken off your patient panel. So it is certainly easy to go through, even in a 15, 20-minute time span, to add patients to a patient panel and remove them over time as needed. There is a way that you can add end dates to notifications by clicking on this pencil, clicking in this white box, and say you only were interested in getting notifications for a patient for several months. So say in November, I no longer want to get notifications on my Donald Duck patient. I'm just following them for this period of time. After November 10th, you would no longer get the notification, but the patient remains on your panel until you actually delete them with the red check. So just something to make note of. And then one of the great new features that we have, I'm sure and hopeful that a lot of folks do already know about this, but I think it's a great enhancement that we've made to this My Patient section, is over on the right-hand side. There's a button that says Show Notifications. And this is a great way to manage your notifications that you're getting. So rather than having to copy and paste any information that you're getting in our notification email that you get from us, you can come, and it's here that you can get the last 180 days of notifications for your patients. You can get all of the necessary information that you need. When did the notification get sent to you? Who is the patient? Where did it happen? What type of notification is it that you're getting? As well as being able to view those daily summary event notifications as well. So if there were more daily summaries here, they would be listed. And then a great feature to this is the fact that you can easily maneuver seamlessly from this view of looking at the notifications to clicking on the medical record number here, which is a hyperlink. And that will pull in all of the necessary technical information where I can actually get into the record for Abigail testing here, and I can learn more about this inpatient discharge that she had from Northern Light Eastern Maine Medical Center. So you may still have to break the glass on that patient if you haven't opened that record within the last 3 days, but it is so much easier than having to do a lot of that manual copy and paste work from the email notification that you get. And the other great feature that I always highlight about this enhancement is this little button here that says CSV that's down at the bottom. So it's here that I can export my list of notifications to a CSV file in Excel. And it's here you can sort the different columns to be able to say you're looking for some trends for high utilizing ED patients. You could sort just by ED visits and be able to track those trends over time through the Excel spreadsheet, and be able to highlight those folks that may be using the ED on a frequent basis. So that's a really great feature that I always let folks know that they can utilize in this view. I know I've talked a lot. We have about 5 minutes left of the webinar. Chad, are there any questions or anything that folks can think of before we come to a close here?
Yes, there are a couple in the chat, so I'll call them out for you. So
great.
I've been taking some notes on folks' comments about data gaps. And so we hear you, and again, we'll continue to try to close those data gaps so the patient records continue to be useful to you in York Hospital as an example. So we'll take that one back internally. So Nicole, some additional comments to address. So one is, do you have to break the glass for mental health if a patient has opted in, or should that information always be included in, for example, their sensitive data folder?
Yes, so say, let's just do a quick search here of Minnie Mouse. As you can see, this Minnie Mouse here has a date under mental health consent. So if I open up this patient, and I do have to break the glass because I haven't accessed that data, or I haven't opened that record in 3 days. what you would see is that there isn't a disclaimer for this Minnie Mouse up at the top, but there is a sensitive data displayed folder that would automatically populate. So great question.
Great. Next one is, can information on lab results be printed off and placed in a client's chart?
It can be. So there will be anything that has a print button can be printed up in the corner. And so that's certainly something that's available for folks.
Okay. And the last one that I'm seeing is, could you provide maybe a best practice for staff to know if another provider has discussed what's included within HealthInfoNet's chart with their patients so that their staff aren't sharing something that's not already discussed?
So certainly we have only the ability to display information that we're getting from providers. So it's important to go through some of that documentation and read if something was mentioned within the document that we're getting from that particular sending facility, if they mention that they reviewed information in HealthInfoNet. Ultimately, we just have that data connection with them. There isn't anything we can do on the HealthInfoNet side to make note of anything or to add or remove anything. It is up to the sending provider that is sending us data. With that being said, it does make a good, or put people at ease that there isn't anything here that a user can't remove, delete, anything like that. So what is here, and it is really up to the sending provider whether or not they make note of that and document it in their documentation. Good question.
Great. Thanks, Nicole.
Yeah.
So it's just the last few minutes. I figured I'd throw up the HealthInfoNet educators slide that Nicole had alluded to previously. And so I know there's been a lot of great engagement, questions, comments in the chat. I think we answered most, if not all of them today, but if folks continue to have questions after today's webinar, here are some more information around how to contact us. So you can reach out to Nicole directly, our other clinical education coordinator, Sharon Bearer, as well as just a generic clienteducation@infonet.org email address, and we can certainly follow up with you on any remaining questions that you have. So like Nicole said, we can stick on here for the last couple of minutes if folks have questions to add to the comments. Otherwise, we can follow up with you separately.